Hello, it's Thursday, October 31st. Happy Halloween, and it must be time for another legislative update from your North Carolina Medical Society. Today is supposedly the last day. I've come back over from the General Assembly to record a quick video for you. I think that we're going to be going later into the evening, and still so much is uncertain. We're uncertain about whether we're going to actually have Medicaid transformation funding. We're uncertain about whether we're going to try to actually cover more North Carolina citizens with some kind of affordable insurance. We definitely are unsure about the step therapy bill, the prior authorization bill, the regulation of PDMs, all those things that we've been telling you about. Really, healthcare is just kind of in flux right now. Very little things are moving on the healthcare front. They are trying to move the rural health stimulus funds, and this is that bill that we told you about that was started in the Senate weeks ago in order to try to bail out some of the struggling rural hospitals. And even that has run into serious difficulties here in the waning days, and it's uncertain as to whether that thing is even going to move at this point. So we really just came back to record this to tell you that this is one of those times where we just don't know what's going on. There's really nothing you can do right now to help this. They're going to do whatever it is they're going to do tonight and then go home. And then we're going to report back to you on Friday and kind of tell you where things are. What we do know, the adjournment resolution says that they are leaving today at some point in time. Maybe it ends up being tomorrow. And they are going to come back in just under 2 weeks to deal with some redistricting pieces. There's also a caveat in there. They could adjourn to a date certain to do other things, but then the next date that we know that they would be coming back would be January 14th. And that will be the next opportunity, at least according to this adjournment resolution, where we could handle healthcare issues. So all these things that we've been worrying about, whether it's Medicaid transformation, covering more folks, all the different things that we've been really prioritizing, those will not be addressable, at least for now, until January the 14th. So the real message for today is, what can you do between now and then? So many of our members have been reaching out to us saying, we want talking points on this, or we want talking points on that. And what I really need you to do is not worry about the right talking points and not worry about the messaging on certain bills, but is to do exactly what we say all the time, and that is go back and build stronger relationships. Find out who these folks are as people. Learn about their businesses and their families. Get to know them as human beings and let them know you as a human being. And when we get closer to January, coming back in January, that will be the time to start having talking points conversations. But this is just the right opportunity for you to use this time over the holiday, when they're going to be gone for a little while, maybe coming back for a brief period of time to do this redistricting. But this is the time to really get to know folks as individuals, because that is where the heart changes occur. And that's what we've been talking to you about being necessary for some of the compromise, some of the agreements to actually work out. It's not going to be one on facts. It's not going to be one on money. It's not going to be one on any of the talking points that we could rattle out to you. It's really going to be in conversations, one-on-one conversations in real relationships. So I challenge you to do that. If you need help with that, reach out to us. Call me, call Sue Ann. Let us help you with that. But until we know more, I hope you have a great weekend. Enjoy your holiday last night as the time you're watching this video. And we look forward to bringing you a kind of a recap and what to expect during the interim very soon. Take care.